going to be talking to you about family planning today and what this all entails. So what does family planning actually mean? Okay, family planning. So when we're talking about family planning, it is either going to be a patient that is trying to prevent pregnancy from occurring or trying to plan a pregnancy. So we're going to talk about both of these and several different considerations that need to be taken in, and then also how we can make them most successful with what they've chosen for themselves. So let's first talk about that patient that wants contraception. Okay, so this is the patient that is trying to not get pregnant. So what are the considerations we need to take into account? There's several. So one of the first things we need to consider is if they have any religious or cultural preferences. Because if they have something, if they don't believe in taking the pill, for instance, then we need to find out what's going to be effective for them. We need to know their age. So specifically an older patient, there's certain medications that might not be as good for them. And when I say that, for example, I would mean the oral birth control pills. And that's because oral birth control pills put you at a higher risk for blood clots. So because of that, it wouldn't be a good idea because older patients are already going to be more at risk for that. We also need to know if they're a smoker. Same reason. Smoking puts you at a higher risk for blood clots. Oral pills put you at a risk for blood clots. So we want to not prescribe that for that patient. We need to know their sexual history. So with this, I mean, do they have risky sexual practices? And what does that mean? So risky behavior means they have multiple partners. Somebody that has risky sexual behaviors would not be the best patient to have something such as an IUD or an intrauterine device, it's also known as. So we don't want to really give that to them. And that's because the IUD is placed in the uterus. And so people that have risky sexual behaviors are more at risk for sexual transmitted diseases or infections, STIs. And so that puts them at a higher risk for infection. So if you already have something in your body like an IUD that's foreign, it's going to put you more at risk for infection. And there's other medications and devices and things that they can use. So that would not be recommended for them. Then we need to know if they are breastfeeding. And the reason being for this might be a patient that has had a child recently and just isn't quite ready to get pregnant again. So for this patient, we want to give them something called the mini pill. And that's because it's a progesterone-only pill. So it'll help keep their milk supply, which is important if they're breastfeeding. So we need to know that. And then whenever contraception is being discussed, we really need to know what the patient's goal is and what's going to work best for them, okay? We need to find something that's going to work for them that they're going to be compliant with. And it's important to stress to the patient always that the only way to be 100% effective is going to be in preventing pregnancy is going to be using abstinence. And same thing from preventing STIs. So we want to always prevent STIs. And if they want to prevent pregnancy, then we need to also just let them know that the only way to be effective is going to be abstinence. So now if we have a patient, we changed here and we have the opposite. We have a patient that wants to get pregnant. So for this patient, we have some different considerations. So the first one we'll talk about is something called the basal body temperature tracking. So with this, the patient is going to take her temperature daily. Okay, so daily temps. And it is at the same time. So really it should be done before they rise out of bed in the morning. Okay, so they take that temperature and they track it. So over here you see temperature, and we have this drop. This drop and then this rise that happens, this means ovulation has happened. So for this patient, she saw that she had ovulated, and that's when she would have intercourse because she's most likely to get pregnant. Because remember, ovulation is when that egg gets dropped out and comes down the fallopian tube. So this patient, her temperature stayed up, which means she was successful in getting pregnant. If she had not, the temperature would have dropped. So temp tracking is looking for when that temp drops, which means ovulation. So we're looking for ovulation. Then there's ovulation predictor kits. So these are just over the counter, and a patient will simply just void on a little stick and it'll give them a happy face knowing that they have ovulated. And then with the calendar method, with this way, they are going to track their menstrual cycles over several months to get an idea of when ovulation occurs. So these patients also watch an ovulation because that's our key for when we can get pregnant. So watching ovulation, and then they're gonna, so let's say if they do have a cycle, a 28-day cycle like normal, and they find that they ovulate on day 14, then they are going to track that on the calendar to see when ovulation occurs. So this one's tracked over a few months, and then they can keep tracking. And then the basal body temperature. Of course, patients can also combine these. All right, let's compare now some more permanent methods for contraception. First, we have the vasectomy, or we have tubal ligation, also known as tubes tied. So with these, with the vasectomy, we have the vas deferens that is going to be cut and cauterized, okay? So it's cut and cauterized so that the male becomes sterile. It's important to know that this is not an instant fix, okay? It's about 3 months before. So this patient needs to know that they need to use other birth control methods for extra protection. They will have to undergo some sperm counts to make sure that there's no more live sperm in there. This is going to be outpatient. It's an outpatient procedure, usually just a few days of recovery, easy. Tubal ligation, on the other hand, this one is done for the woman, and it is when they will take the fallopian tubes, clamp them, and tie this so that no egg can travel through that tube anymore. So this will sterilize the women. For a female, this is a little bit more of an intense procedure, a little bit longer recovery. Okay, so recovery is longer. This is a good option for a woman that has had a C-section and it's her last baby that she wants to have. Then while they're already in there from doing the C-section procedure, they could go ahead and do it. But there's going to be far more pain with a tubal ligation for recovery and longer recovery than with a vasectomy. So just important to remember. There are a few key points to remember. So it is important to always consider the lifestyle of the patient. What is going to be best for them? We need to know what they are going to be most compliant with. Okay, that's our number one, is our compliance level. We don't want to give a patient birth control or birth control pills to take if they're not going to be compliant with them. Otherwise, there's no point. So consider their lifestyle and what's going to work best for them. Then we need to know, of course, if they're planning a pregnancy or they're trying to prevent a pregnancy, because that'll be a huge difference with their end goal. And then we need to know that there's many, many options. So if something doesn't work or they don't like how something makes them feel, then we can always switch up and try something different. So there's birth control pills, IUDs, which is that intrauterine device, condoms, diaphragms, temp tracking, ovulation kits, calendar methods, all these different tools that the patient can use. So reproduction and our patient education will be the nursing concepts for this. Obviously, with a family planning, we are talking about reproduction, either how to make it happen or how to prevent it. And then there's a lot of patient education that goes into this, education on how to take the pills correctly, how to use the birth control correctly to be compliant and have it work effectively. And then we also would have a lot of patient education, even for a patient that is becoming pregnant. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.